Hello and welcome to the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Our guest today, he comes back at least once a year, Dr. Geoffrey Mt. Varner. Welcome this morning.
Good morning. Thank you very much for having me.
So, Doc, and I've called you Doc so many times, I had to ask you what your first name is. But we're coming on to cold and flu season, and I'm starting to see more and more people put those masks back on. What is going on there? Is there a new strain coming out of COVID?
There is a new strain. It's the EB1, also known as the Iris strain. It is a variant of the Omicron strain. And what we are seeing is that there has been a 14% increase in new infections compared to this time last year, August. So there's definitely a rise, and the ERs are also reporting that there's a rise. The number of hospitalizations have gone up about 17%. And so we've got a new strain, and people are recognizing that prevention is probably one of your best options.
You know, the first COVID, it would affect you as far as your lungs go. And each COVID has had its different signs and symptoms. How is this one different? How does this one work? Does it impact your respiratory system? Do you just feel like you have a cold? How does this one work?
So this one, fortunately, it presents like the common cold. Runny nose, sneezing, cough, just similar to the common cold. It's usually an upper respiratory tract infection or symptoms, and upper meaning nose, mouth, whereas your lower respiratory tract system, your like lungs, that's how the first version of Omicron got you, which is why we had pneumonias and ventilators. But this one, this Iris appears to be upper respiratory, and what is missing though, you're not losing your taste.
Which is a good thing.
Which is a good thing, absolutely, absolutely.
So is the quarantine time the same? Is it the same kind of recovery time as it was?
It kind of is, and patients ask me that a lot. And so standard is usually about 5 to 7 days. However, everybody's body does not read the same medical book. And so there are some people who may need longer, meaning that if you're symptomatic, you still have your runny nose, still feeling drowsy, still feeling like you've got the flu, then you may want to quarantine for a little longer.
What about as far as treatments go now? Is there a new booster available?
So in terms of vaccines, there is one coming. It is scheduled to be released late September. It's a bivalent one.
What does that mean?
It means it only has one component of the virus, and this component is geared towards the new strain. And so if you can possibly wait until September, then you can wait and you can be vaccinated of one that protects more against the new strain. However, if you have reached the point where it's time for you to get vaccinated, and you know you're about to go into a high-risk area soon, then go ahead and get the current bivalent vaccination, because you will still have some protection as well.
Okay, so the old vaccine, it doesn't give you the full protection that this new one.
Let me frame it differently. It does not give you as much protection, because this one is geared uniquely towards Iris, whereas the former ones were geared towards some of the other variants. But as I started off saying, the Iris is simply a a variant of Omicron. So there still has many of the same antigens, many of the same DNA components.
But your best recommendation is to wait.
It just depends. But if you're not going out in a high-risk area, wait.
Okay, it's vaccine time as well, and you're talking about the end of September. It's also time to get your flu vaccine. And some people might want to get your pneumonia vaccine, all those vaccines that you want to get, especially if you're over 50.
Yes.
How safe is it to get all these vaccines?
Well, that's an interesting question. So there are 5 vaccines that if you're over the age of 50, you should talk to your primary care. Your tetanus, your pneumonia vaccine as well as your shingles, and then you've got your flu and your COVID. And so the recommendation is that yes, you can get multiple vaccines at once. And this questions came out last year this time. Could you get COVID? Could you get your COVID vaccine and your flu vaccine at the same time? And the answer is yes. Now the question is, can you get 5 at the same time? I would definitely talk to your like primary care doctor. And if you go to the CDC site, no one gives you an absolute number that you can get. However, I would recommend that if you can spread them out, maybe get 2 or 3, the ones that are more acute, such as the flu, COVID, and maybe the RSV, and possibly delay the others just by a couple of weeks.
You know what, we've been hearing a lot about this RSV, and the commercials come on every 2 minutes. Is this a promotion by the pharmaceutical companies more so than, is it as urgent as they say it is? Or is this just a push by companies who want to, of course, make a decent amount of money from people getting these vaccines?
It's a combination of both. RSV, also known as respiratory syncytial virus, it's been around for many, many years. It most commonly affected kids, those 6 and younger. However, what we've seen is that there are a number of adults being infected, and those infections are resulting in hospitalizations. But in general, if you're over the age of 60, you should consider it, because every infection is an insult on your immune system.
And does this come off like a cold as well, or how does it manifest, or how does it present?
It comes off like a cold as well. In other words, there's no clinician, doctor who can look at you and say, oh, you've got the flu, oh, you've got COVID, oh, you have RSV, oh, you have just a regular cold. No, because it presents the same way. Hence, getting vaccinated, it helps prevent you from getting those that I just mentioned, except for the common cold. There is no vaccination for the common cold.
Do you think it'll ever be? So what should we do as far as prevention? Still the same things, keeping your hands washed and things like that. What are your best recommendations for staying safe?
So right now, the name of the game is prevention, 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 prevention. Wearing your mask, that's a big one. Back in hospitals, we are back to wearing masks again. Washing your hands. And consider distancing. If you're standing in line and you know that someone's coughing and sneezing, you may want to step back. I often carry my mask if I am about to get on a crowded elevator. Ooh, that's the time I'll reach my pocket and put my mask on.
That was my next question. When is the best time to mask? Do we have to mask everywhere now, or is it elevator, supermarket, church? Where should we mask now?
It depends on your risk tolerance, and it depends on your baseline medical level, meaning that do you have a lot of chronic conditions, meaning that if you get infected, is it more likely for you to have a more difficult outcome? If you fall in that category, and those people are usually, they're older, diabetic, high blood pressure, they have chronic health conditions. And so the rule of thumb should be, if you're going in a crowded area, mask. Because if you get sick, meaning those people with chronic health conditions, their outcome may be a little different. But just as a rule, when in doubt, mask.
In my family, it's been very strange. During the Christmas of 21, 3 of us got it, 3 didn't. But since then, I am the only one, knock on wood, who hasn't had it. If you've had it multiple times, one of my sons has had it several times. How dangerous is that if you've had it 2, 3 times?
So let me just tell you what the latest studies are showing. And this is why getting vaccinated, it becomes even more important. As we already talked about, with this new strain, if you get infected, you're probably going to have a regular outcome, and you're going to be fine. But what studies are now showing is that multiple infections increase your health risk, meaning that with every infection, you're 3.5 times more likely to develop lung problems, 2 times more likely to develop heart disease, 2 times more likely to develop neurological disorders.
In the future is what you're saying.
In the future, yes. And so every infection is an insult on the system. And in fact, one recent study showed that those over the age of 65 who were infected with that COVID earlier, they are 63% more likely to develop Alzheimer's. And so what I didn't say 63% would, it just puts them at 63% increased risk compared to those who did not get infected with COVID. And so the name of the game is, and I get it, people, they're young, or you've had it, you think you're fine. This is not like getting infected with the flu, not like getting infected with the common cold, where once the infection's over, there are no more adverse outcomes. What COVID is showing is that every new infection increases your health risk.
What about the drugs for once you have COVID that help cut the time of infection in half?
Well, they are still out there. The monoclonal antibodies are not, but they're still out there. And so as a person who reads the literature, as a person who practices in the ER, I would highly recommend people talk to their primary care doctor, because not everybody should get it. Meaning that if you are at risk for having a severe outcome, then consider the most common one, which is Paxlovid. It has been my experience practicing and in reading is that often it makes people feel worse initially. Yes, now again, it's a risk benefit. If it's a feeling worse versus being hospitalized and possibly placed in the ICU, then obviously you want to take the Paxlovid. But what we're finding, as we talked about earlier, is that the Iris strain, it's not causing a lot of ICU admissions.
Wow, this is some powerful news. We were talking about people who have had COVID several times. What if you're kind of like me and you haven't had it? Well, are you more likely as the time goes? Is it going to be a thing where at some point in time everybody's going to get it?
Well, that's what we said this time 2 years ago, that everyone is going to get it. But there are many patients, and studies are very, very clear, there are still several million people who have not gotten it. You just gave a wonderful story. You were at Christmas, half your family got it, and the half of the family did not. They are no longer saying that everyone's going to get it. Some people are immune. We don't know why. You're fortunate where you have not gotten it, and you may not ever get it. But what I would encourage you to do is still prevention. Get your vaccination, and take your vitamin D. You know, vitamin D, there's also something.
So that is true.
Oh, vitamin D, 100% true. You add things like zinc and elderberry and echinacea. And by the way, the zinc, the elderberry, the echinacea, even prior to like COVID, those were proven to be helpful as it relates to viral infections. Vitamin D was proven that, hey, if your vitamin D level, you stand a better chance of having a positive outcome if your vitamin D level is normal or on the higher end of normal.
And so as we move forward in the future, is this something that we're just going to see every season for the rest of our lives?
No, if I had to look at my crystal ball, the answer is yes, because and the evidence of that is the flu. Think about it. Since we were kids, we've seen the flu every fall, and we have no reason to believe that COVID is going to be any different.
As far as the death rate, we know so many people. It's so sad, the number of people who died of COVID. We're not seeing people dying at the rates that they were in the early stages. It's because we know more now. If you know more, if you know better, you do better.
Oh, love that. And I do appreciate how you framed it. We're not seeing increased death rates because we are still seeing deaths from COVID daily. And you're right, we know more, we do better, and people were vaccinated. So the fact that they were vaccinated, even if they do get infected, their symptoms are not as bad. And by and large, most Americans have some kind of antibody in them, whether or not it is from naturally being infected or whether or not it's from being vaccinated. So most people have those antibodies, which means that if it's their first time infection, that their antibodies are already ready to fight.
What do you say to the quote unquote anti-vaxxers? People who don't believe in getting the vaccine or who believe that COVID was some kind of hoax?
Well, we're 3 years into that and several million deaths, and we're not going to change our mind. And that's unfortunate, but what we do know is that the vaccine has saved several million lives.
That's good to hear. That's good to hear. I want to pivot a little bit to another topic. We're seeing now that over the next few months and years that we're going to have more help with drugs. Things like drugs for diabetes, they're going to be cheaper pretty soon. What kind of an impact do you think that'll have on the medical community?
Oh, it's going to have a humongous impact because at the end of the day, while we spend a lot of time in treatment, prevention is key. And as it relates to the drugs being available, and even for a cheaper cost, it means that more people will have access to them. In other words, in the ER, there are several times I come across diabetics or even people with high blood pressure who simply stop taking their medicine because they couldn't afford it, or they ration it out. They say, hey, I'm going to take a tablet every other day. So having these new low-cost medicine, it's going to change the landscape.
Can you say that again? People don't believe that that's happening. Where people will take their medicine every other day, take a half a dosage, or trying to ration because of the cost. This is a serious thing.
It's a serious thing. Not only do they, and even if they can afford it, if your best friend can't afford it, what are you going to do? That's your best friend. You're going to ration it. You're going to give them half. Because the doctor's only going to give you enough for like 30 days. You've got your best friend who can't afford it all. So you're going to ration to her as well. So this medicine being available to everyone is absolutely key. People will say, well, pharmaceutical companies are not going to want to develop new drugs. Well, hold on. What it means is instead of making $5 trillion for a lifetime, you get to make your trillions of dollars during this period of time, and then it becomes available, meaning that Medicare has to bargain for it. And keep in mind, once Medicare bargains for it, Medicare's not getting it for free. It's just that the pharmaceutical company, they don't get to dictate their prices. And one last point, there's no other industry where the company you're buying from gets to dictate the prices. Even in healthcare, Medicare, when you admit a patient, they dictate. Medicare negotiates the price with the hospitals. So now that's what we're doing with the pharmaceutical companies now.
You know what's interesting too with the different medical plans? It's like we've got all of these different new drugs for this, the diabetes, different instruments that you can use to, help you follow your daily blood sugar levels. But you've got these healthcare companies that won't pay for it. So what good is it? What good are all of these new innovations in medicine if we can't access them?
Well, some people can and some people cannot. It's not unusual for a new drug to come on the market and a certain percentage of the healthcare plans say, hey, we will pay for it, and a certain percentage of it say they won't. But there are always exceptions. Talk to your primary care provider, go to your local hospital, and there's always a patient navigator there who can help you navigate this. Again, I've seen it thousands of times. There are always exceptions that once your insurance company says, no, we won't pay for it, there is an appeals process and an appeals route.
And that's good to know, because people think, well, they said no, it's no.
Yeah, but let me also add, there are very few drugs that there's only one drug in that class. So maybe your insurance company is saying, I will say the A drugs A, B, and C, they're in the same class. They're in the same class of, say, high blood pressure medicines. They may say, I'm not going to pay for A, but I will pay for B and C. And that's not unusual. Again, rarely is there one specific drug that, and that's the only drug that a patient can have. However, when that happens, and your insurance company says no, be sure to write a letter of appeal.
And also, let's go back to the number of vaccines that you can get in at one time. How do you prioritize? If you say, okay, I'm just going to get 3 today, and then I'll get the other 2 at another time. How do you decide which is most important for you at that particular time?
I think that given the season, the season means there's a lot of infection going on. There's a lot of infections rising. I would consider the COVID, the flu, RSV, and if you're going to get a fourth one, shingles. Shingles is always present, and so if you're going to do it, I would add the shingles on there too.
I got mine immediately, but I've seen people with shingles. That is not something you want to get.
Yeah, I've treated thousands of people with shingles, and patients don't realize that it's painful. Sometimes it is disfiguring, depending on where it appears, and it's a very miserable infection that's preventable.
Can you get 2 things at once? For example, can you get COVID and the flu at the same time?
Yes, you can. And in fact,
that sounds brutal.
In fact, in most of the hospitals that I work at, when you come in for a COVID test, or when we're testing for like COVID, we're often testing for COVID, RSV, and the flu.
Well, what do you do with a patient who's got all those things at once, if someone does happen to?
Well, if the vital signs are stable and they are clinically stable, depending on their medical history, the vast majority of them go home. And when they go home, it's hydration, sleep, and again, vitamin D.
Why
echinacea.
Hydration?
Because hydration, it does a few different things. It helps our natural immune system optimize, because everything works on water. Our liver that helps create a lot of our cells. So we need to stay well hydrated to optimize the liver function. But then keep in mind, our kidneys, it helps clear a lot of the bacteria, viruses, and some of the other elements. So staying hydrated is extremely key. And then keep in mind, one of the natural barriers for our immune system are our lungs. Our lungs have a very thin layer of mucus that helps block a lot of the bacteria coming in. So it's the way you produce that mucus is by being well hydrated.
And the lungs are something that once they're damaged, they can't be repaired.
Depends. If you being relatively healthy, if you get pneumonia and it is treated quickly and fast, your lungs can be back to 100% to where they were prior to the infection.
How much does what you eat play into how you can keep your immune system healthy during this time of year?
It plays a humongous role. So, for instance, there are some foods that are already rich in vitamin D and salmon and zinc, and those would be mainly your like fishy foods. For instance, your salmon, your tuna, those are rich in immune supplements. I mean, well, they're not supplements; they're rich in vitamins. And then also fruits. Fruits are extremely helpful. It's the bright colored fruits that already have some of the vitamins that we need.
So we've got a few minutes left. What is your best advice to people as we head into this season?
My best advice is your spirit means a lot. So just mean that make sure you keep your spirit up.
So you mean mental health?
Mental health means a great thing, but I also mean spiritual health, just how you feel daily. And one way of of doing that is going out for long walks. And by the way, when you go out for long walks, you're exposed to the sun, and 90% of our vitamin D comes from being exposed to the sun. So that would be
Say
extreme.
it again, Doc.
So 90% of our vitamin D comes from being exposed to the sun. And as you know, any form of exercise, it usually boosts those endorphins. It just makes you feel better. So keeping your spirit and your mental health strong. And then again, as we have talked about, prevention, prevention, prevention. That includes vaccinations, that includes vitamin supplementation, it includes exercise, and it includes wearing a mask when you feel like, whoa, I am in a high-risk environment.
And mention that water again.
Oh, and then hydration, hydration, hydration is absolutely key.
Because a lot of people, oh, I can't drink water, I don't like water, you know, you got to do it.
Oh, you have to do it. You have to do it. And as long as you don't have congestive heart failure or any kidney problems, you should be drinking anywhere from 8 to 10 16-ounce bottles of water.
That's a lot.
A lot.
But it's good for you.
It is.
It is absolutely good for you. So hopefully you will have a healthy winter as we go through these next couple of months. Hopefully I will. But I just wanted to make sure that we got the word out there. There's so many questions. I was in the pharmacy the other day, and the person in front of me was asking the pharmacist, can you take all of those vaccines at once?
Yeah, and so let's just pivot back to that. Again, talk to your primary care doctor. But if the question is, if you don't get them all 5 now, you're not going to get them at all later, I would consider getting all 5. Now, if you know that, hey, I'll take these 3 to 4 now, but I'm going to come back later, and you know you are the type to like come back, then I would recommend it. I would recommend doing it that way.
And can you especially say to the men, because it's hard to get that man in there to do the right thing.
I say to the men, and I will say to the women in their life, studies show it's the woman often that drives the men's healthcare. And don't forget those supplements. And you know, there are certain supplement companies that I've noticed, like Shield Vitamins. They have a great supplement. Most of them are gummies. But making sure that you prepare for this season, because the season's upon us. And so we can do our own prevention.
Dr. Geoffrey Mt. Varner, it is always a pleasure talking to you. I try to have you in here at least once a year.
And I'm always honored.
My technician always tells me you're the only man I ever have on the show. So I don't know whether that's a compliment or whatever, but you always come to us with some great information.
Thank you very much for having me, and I look forward to my next time as well.
All right, you've been watching the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Have a great day.